and what was the data indicating in terms of the problems that you're seeing in the system at a large scale, being at Kaiser, as well as what were the outcomes of understanding this data?
Yeah, large scale is definitely true because we see more than 1 million patients coming through the emergency departments every year. So there's definitely a lot of patient information and data that is coming through. So what we did was we picked a few topics to study. Um, for example, we were looking at pulmonary embolism. And number one, what we found was that, of course, the practice was very um, uneven in the sense that there's a lot of variability between one center to the other, one physician's practice to the other. And so first we wanted to study that,
Mm-hmm.
look at the retrospective data and see what we can learn from it. And the second thing we did was we looked at the literature to see are there any risk stratification tools that will help the physicians practice in a way that will help them make decisions. So can we use risk stratification
Mm-hmm.
tools to help them with clinical decision support? And so we built this application on the platform. What it does is it'll collect data from the specific patient that the patient and the physician is seeing, and it walks the physician through a few steps and then gives them information about that patient. It analyzes the data and gives the information to the physician. It says that the chances of this person having a bad outcome and gives a number, and based on that number, it will also tell the physician what the next step should be based on this data. So it is giving that kind of support so that the physician can make the right decisions. One of the things we noticed was that about 95% of these patients were being admitted to the hospital once they were diagnosed with pulmonary embolism. So one thing we know is that a lot of low-risk patients, they do just fine. They don't need hospitalization. So we implemented this clinical decision support so that physicians will be comfortable finding those low-risk patients so that they can be sent home on outpatient medication.
Mm-hmm.
In a way, improving the quality of work and improving the patient satisfaction because the patient will be happier at home, and also improving the outcomes for the organization.
Mm-hmm.
That was, and it was a great success.